Wonderful, thank you. Welcome everybody. I am Dr. Leslie Fall. I am the Executive Director and Chief Executive Officer at Aquifer, and it is my fantastic pleasure today to introduce my colleagues at NYU and our WISE program to talk to you about using WISEMD and WISE-OnCall in your teaching and education programs. So if you'll go ahead and advance the next slide for me. So as I said, I'm Leslie Fall. I'm a former pediatric hospitalist and Chief Executive Officer and founder of Aquifer, formerly known as In Time EdMed. I know Tom will talk a little bit about that today as well. Just before we get going though, a little bit of logistical notes for everybody. Number one, to preserve everybody's bandwidth, please do mute your video as we get started in the program. That will help. You'll also be automatically muted when we come into the program. Please stay muted unless you're called on for a question in your session. Your breakouts obviously will happen magically. I think everybody's pretty used to Zoom at this point, but you've been set up for your breakout sessions. And unless you're asked to ask a question or talk, please stay muted at that time. Please place your questions in the chat, running chat. We have a number of people who will introduce themselves in the chat in the background who are monitoring the chat to answer your questions for everybody directly and also singularly from both of our teams on both sides. You will be sent to a breakout room automatically based on the preferences that you registered for. But if you find yourself in a breakout session that was not what you have been interested in, as you know, there's a button on the bottom right-hand side that will allow you to jump out of that breakout room and get yourself reorganized if that's not the right session. And finally, the session is being recorded. We will talk at the end about providing the recording to you directly by email and then also posting it on our website so you or your team members can come back and take a look at it at a later date. Next slide. So I'm here to talk for just a brief moment about Aquifer. Aquifer is a nonprofit organization that I co-founded in 2006, back with my good friend, Dr. Riles. Our mission is dedicated to delivering the best healthcare education through collaborative development, research into innovative, high-impact virtual and teaching learning methods. Next slide. Our mission is based on our national collaboration with a number of organizations, the key clerkship director organizations in most of the major medical disciplines. In addition, we've had a long-standing partnership with NYU in their WISE program. And so it's been wonderful to see the transition as we've gone over the years, and Tom will talk a little bit more about that today. Next slide. We are particularly proud of our response to the COVID pandemic. I believe we were some of the earliest online virtual learning companies to come out with a COVID response, providing free courses pretty much to the world over the course of the last quarter of the academic year throughout the pandemic. During that time, we served nearly 500 institutions and had over half a million cases completed simply in April alone. As we went into our subscription season this year, we offered a grant program, which most of you I'm sure are aware of, and we are again very proud to have awarded a total of $1.2 million in grants to programs to help offset the price of going into an entire online program. We're now serving 166 programs and now have subscribed to the full Aquifer platform. Within that context and that partnership, it is really my great pleasure, though, that we have partnered since 2006 with our colleagues at NYU WISEMD. And during our grant program, they too awarded $367,000 to offset the subscription cost for WISEMD and WISE-OnCall to well over 100 programs. And Tom's going to talk about that in just a minute. Next slide. So it is my wonderful pleasure to introduce my longtime friend, Dr. Tom Riles. Tom is the Frank C. Spencer Professor of Surgery at NYU Grossman School of Medicine and the Associate Dean for their program in medical education and technology. And it is really the founder of the WISE concept and the WISE program. And Tom, with that, I'm going to turn the session today over to you.
Thank you very much, Leslie. It's wonderful to look back over the number of years we've had such a great partnership. The agenda for today is here, and just go over it. We're going to do a quick review of the history of WISEMD associated with Aquifer. Then there will be a session describing WISEMD, since many of you are new users. We just want to give a little bit of a description for those that are not deeply familiar with it. This will be followed by another review about WISE-OnCall. At 3:30 promptly, we will go into the two breakout sessions. One you've already signed up to, those who've signed up, either WISEMD or the other two, WISE-OnCall. And then at 3:55, we'll come back for closing remarks by Dr. Fall. Next, please. So the objectives today are basically to learn more about WISEMD and WISE-OnCall and how you can use them in your programs, whether it's a PA program, a nursing program, medical osteopathic schools in UME, and even in GME. So we have some very experienced individuals that will be talking with you today about this type of thing. And we also want you to ask questions and learn about additional resources. Next, please. There are a number of great speakers, and I'm not going to introduce them all because they will be introduced in due time, but it's going to be a busy program, so we'll move ahead. Next, please. WISEMD really began with my tenure as chairman of surgery. When I came back to be on the academic side, it was shocking to me how surgery had changed from a student's point of view and how little students were learning. Not only were the lectures appalling, but also patients that were coming in for surgical procedures rarely spend more than 24 hours in the hospital. All the important stuff was done in the surgeon's office, consultations, outpatient imaging, pre-surgical testing, and recovery at home. So the idea of developing something that would be suitable for today's needs for teaching surgery was the origin of WISEMD. Next, please. Go ahead. Yeah. So the concept, we'll go over it a little bit. Dr. Hopkins is going to talk about this, but we wanted to have the high quality content that was peer reviewed. We wanted to use multimedia presentation, thinking that with the technology that was being developed in the almost 2 decades ago now, we could do much better than having a box of slides on the table. And also we wanted to make sure it was available on demand so that students could see the content anytime they wanted to. And we also wanted to have good reports for our faculty. Next, please. So the first module was developed in 2003 with Dr. Marianne Hopkins, who will be the next speaker. And also it was with financial support from New York University School of Medicine, some grateful patients who wanted to do something to help us out with education, and also the American College of Surgeons. Next, please. So we began nice partnerships, beginning with the American College of Surgeons and the Association for Surgical Education, and they've been providing most of the content development over the years. And next, please. And we had this wonderful partnership that began with Aquifer. Actually, it was in time. Actually, it was 2 or 3 years before this, but when we really engaged together in a partnership, it was a wonderful marriage. And you can see the growth of WISEMD once that partnership was consummated. And now we are way above 125 subscriptions to WISEMD with the COVID intervention. It's gone up to about 196, I believe. So with that, I'd like to turn it over, you can go next, to Dr. Marianne Hopkins, who's Associate Professor at NYU, and she's been the Executive Editor for WISEMD since its conception. Marianne?
Thanks so much, Tom. And as Tom mentioned, what we really wanted to do was to create a very rich educational environment for the medical students. The modules are both case-based and skill-based. So we have modules that will go into how to suture, how to place a Foley, all of that kind of thing. And then with our collaboration with the Association of Surgical Education, we developed a really robust summary question section, very similar to the NBME for student self-assessment. Our objectives were really to provide skilled educators from the Association of Surgical Education as role models, how to do a physical exam, how to talk to a patient, how to talk to your colleagues, really, and also to help demystify the operating room to medical students. Tom showed you a glimpse of the animation, and I never forget, being asked, what's that blue thing? And everything looks red when you're a medical student. So we felt that the animation side by side with the surgery would really help out the students. And also we provided educators with really a supplemental curriculum. Some of us might be in hospitals that may not see breast cancer, for instance, if you're in a VA hospital. And so we have modules that really address the breadth as per the LCME of what medical students really need to see. So on the next slide, you can see we have 22 case modules, all case-based there, as well as 16 skills modules that go into suturing, knot tying, ultrasound, all of that kind of thing. And on the next slide, you can see that each case is sort of laid out. So on the top bar, you will take the student through a 2-minute sort of overview or fundamentals section, and then weave your way as a surgeon through the history, the physical, the lab and imaging studies you would order, the decision making, and then finally the surgery itself and the post-operative care. And on the next slide, you can see that really what we're trying to do is to demonstrate Rovsing sign, obturator sign, all of those things that you sort of can't really glean easily from a 2D textbook. And then on the next slide, you'll see a demonstration here of the side-by-side surgery along with an animation of the surgery. So you can really see the mesoappendix, the appendiceal artery, and all of that kind of thing. Next slide, please. And then we end with some summary questions, again, designed by the ASE Assessment and Evaluation Committee, that are robust case-based questions. If a student answers it wrong, they will get feedback as to why that answer wasn't right, what they need to look for, and really to help them, again, really for some formative feedback. And then finally, on the next slide, as you can see here, faculty will get a report on how their students have progressed. They won't see the summary questions, but they'll see whether the students have done all or only some of the modules and how much of them they will have done. So you will, in fact, get an activity report as well. So next slide, please. I think we'll now turn it over to WISE-OnCall.
Thank you. Yes, this is Dr. Lynn Buckfar-Keltz, and I am one of the co-editors of the WISE-OnCall modules, which I will discuss over the next 10 minutes or so. These have been developed more recently, and the target learners are a bit different as well, as opposed to WISEMD. WISE-OnCall was developed for advanced clinical students and those getting ready for practice, such as incoming interns. Most of the modules are symptom-based, and the focus is on assessment at the bedside and initial management. Next. You can see the content of the modules here. Most are acute symptoms in hospitalized patients, such as chest pain, fever, shortness of breath. We also have modules on documentation for patient safety and certifying a death. Next. The instructional design of the modules include a patient case video, the differential diagnoses organized by appropriate systems and causes, practice cases for the learners to assess their knowledge, and the use of checklists as an organizational scheme for learners. Next. And again, the content covers common inpatient symptoms and signs and includes an extensive differential diagnosis with a focus on clinical reasoning. We include initial assessment and management with an emphasis on when to escalate to a supervising clinician. We also role model professional behavior through the video case. Next. WISE-OnCall modules have been mainly used in advanced clinical rotations such as sub-internships, transition to residency and practice courses, and intern orientation. They can also be considered in earlier curriculum as well. Next. So now I will walk you briefly through this module on hypotension to show you the important features of WISE-OnCall. And similar to WISEMD, you can see across the top banner the different sections, introduction, causes, case, practice, and credits. Next. The modules always begin with the start of a case of a patient in the hospital with a new complaint. Next, after about 30 to 60 seconds of video, we transition to the didactic part. Each module has audio of our physician expert teaching the learners with the use of visual aids that you see on the screen. I took a series of screen captures to illustrate highlights of the module. Here we review the definition of hypotension and shock. Next. And here we review the end organ damage that might be seen in a patient with shock. Again, all of this content has audio of the expert walking the learner through the information. Next. Here the physician expert briefly reviews the relevant physiology. Next. And some pathophysiology put together in this table. Next. And then we review the most relevant physical findings and maneuvers. Here you can see a visual of how you go about measuring the jugular venous pressure. Next. Here I show a slide that shows the discussion of the differential diagnosis. You can see across the upper section that I picked out the obstructive causes of hypotension: pulmonary embolus, cardiac tamponade, and tension pneumothorax. Each of these diagnoses are then discussed in detail before moving on to other types of shock and their causes. Next. After a discussion of the possible diagnoses and their defining features, we go on to a video case. Here we model communication skills and professional behavior with team members and at the bedside. We use an active checklist to help the learner organize the information and build illness scripts. Next. We conclude with a few practice cases for the learner to test themselves. Next. After giving some clinical information, the learner is asked a question. Next. The answers are shown from a +2 through 0 to -2. +2 is right. A score of 0 means being neither right nor particularly wrong or harmful, and -2 being potentially harmful. Each answer has an explanation as well. Next. We also have resources in the right-hand corner. We include the checklists here for students to review and any other relevant information for the specific module. Next. In this module, we have in the resources section a review on how to check for pulsus paradoxus to rule out cardiac tamponade. So that was a quick run through of one of our WISE-OnCall modules to illustrate how the modules work and how the learners go through them. Next. We are a little ahead of schedule, which I think is terrific because that will give us more time to speak within our breakout rooms. So we're gonna, in the next minute or two, go to our breakout rooms, which have been pre-assigned, and then we will join here together again at about 3:55 for wrap up. By the way, while we're in the breakup rooms, when there's about 5 minutes left, we will get a warning on the screen, and then again when there's 60 seconds left. And then again, we will come back together as a group.